week, the government is promising us Freedom Day. Freedom Day. That's a rather a populist title to you, Tom.
Just a bit, yeah, just a bit of a populist nationalist title, yes. Aren't they doing well, the government? Aren't they doing brilliantly? Yes, very excited, obviously, to have, Freedom Day, the freedom to go and catch COVID and for it to be all my fault.
Yeah, individual responsibility. They don't take any individual responsibility. So they seem to have two contrasting ideologies. One that they advocate for us, and then the other one that they completely ignore for them. But I tell you what, I really want to focus on here, Tom, when we talk about Freedom Day, which is in itself, as I say, it's just a label that the government have adopted for the tabloid generation. But I want to focus on a report in the Lancet. Now, the Lancet is one of the most respected medical journals, not just in the UK, but across the world. And it's absolutely damning of the government's intentions. And I suspect that behind the scene, the so-called medical specialists are also towing a line, I suspect, a political line, because you know that they've been told that they can't contradict the politician who's at the podium. So you know damn well also that they are probably having to bite their tongue behind the scene, and that their credibility is being affected, and it's been affected all the way through. You only have to watch Twitter, for example, to look at, the Chris Twitty has been, sometimes he's been really, really applauded, and sometimes he's been absolutely annihilated. And he sounds like a really nice guy. The reports I've heard from people who've worked with him in hospitals are extremely positive. But I just think sometimes he's found himself out of his depth in the fact that you have the likes of Matthew Hancock, Sajid Javid now, and Boris Johnson, amongst others, who have explained to him that it's not about medicine half the time. It's about politics. It's about winning votes. It's about saying things to the people that make them feel better. But if we turn to the Lancet, and I'm sure Chris Whitty would want us to turn to the Lancet and do some actual research, and obviously I'm not going to read it out. And they identify a whole range of things that we should be concerned of. And the first ones are about children, about young people, about the education system. And I think that there's a point that we're about to go into summer holiday. Apparently, people are predicting a really hot spell, which is not friendly to viruses. So it's a time if you are going to open things up a little bit more, as we did last summer. This is it. But I think we need to look at some of the points that the Lancet have made and take them extremely seriously. If I can just go through, as I say, just a few of these. You've got third preliminary modelling data suggests that the government strategy provides fertile ground for the emergence of a vaccine-resistant variant. What are we going to do, Tom, if in 2 or 3 months' time, instead of having the Delta variant, we have a vaccine-resistant variant in which all of that time and effort that's been spent on creating these vaccines becomes entirely superfluous?
Yeah, I mean, it's our worst nightmare, and the worst nightmare of scientists that have worked so hard to produce vaccines and to advise governments and give governments information to make sensible, appropriate decisions to protect the public as best they can. Of course, our government have regularly made decisions that are against the science, despite continually saying they're guided by the science. They have continually throughout the last year made decisions that are against the scientific evidence and advice that they're given, which is really shocking. And in this instance, this is the scientific voices are very, very strong since Monday in saying that there are grave concerns amongst the scientists, based partly on their modelling of current cases, which is zooming up of the Delta variant. Boris Johnson 3 weeks ago delayed the so-called Freedom Day on the basis that the Delta variant was rising and of concern. The number of cases that day was 10,000 and something. just over 10,000. 3 weeks later, on Monday of this week, was 10,000 and something, just over 10,000. 3 weeks later, on Monday of this week, Johnson announced that the government were lifting those mandates for the restrictions or precautions, and the number of cases on Monday was 20. I think it was 27,000 and something. A day later, Boris Johnson announces that they expect, and the modelling shows that it will soon. It's doubling every 9 days approximately. So they will soon expect it to hit 50,000 per day, and then 100,000 per day. So what a time to announce the lifting of these, government mandated restrictions. Bizarre. There is really sad. And I want to make a really important point to everyone viewing this, because it's something that obviously a lot of people have misunderstood and got wrong. And the government knew people would. The newspapers knew that people would misunderstand this, and they're quite happy about that. Boris Johnson on Monday did not say that there's no need anymore for mask wearing or social distancing. That's how people have interpreted it. People all over the internet going, yay, no more mask wearing, yay, no more social distancing. Government did not say that whatsoever. What Boris Johnson announced on Monday was, as of the 19th of July, the government themselves will no longer be mandating those things. They will not be, enforcing restrictions, mandating the use of masks and social distancing. And instead, they are leaving it up to us to decide, when we think those adopting those measures is sensible. And immediately, the scientists said two things. They said, this is a really bad idea for Johnson to be announcing this at this moment in time, with the Delta cases rising and the concerns about new vaccine resistant variants coming, potentially arising from it. And they also said, that the scientists are still strongly advising people to wear masks and socially distance, particularly indoors, particularly in unventilated areas, to wear masks in places where there's a lack of social distancing, like public transport. So people have misunderstood it and gone, yay, we don't have to wear masks or social distance anymore. They've misunderstood what Johnson said, and he knew they would, and he's fine with it. But everyone listening, everyone watching needs to know, he didn't say that. He said, we're no longer telling you, it's up to you. And the scientists are saying you still should.
But have they misunderstood it, or have they been pushed in a particular direction by the media that they interact with to understand something in a particular way? So it's not that they've misunderstood it. They've had the Daily Express and the Daily Mail and the Sun and the Spectator and whoever else, LBC, pumping it down their throats that, hey, now the state has told you no longer by law have to wear it. So if you spent your time, let's say 18 months, being told by the state that you must do something, and then the state turns around and said, now you no longer have to in law. For a lot of people, it is simply just a green light that's being reinforced by the press for them to formulate a particular perspective that it's almost beyond their control. Because, let's face it, all the way through, Boris Johnson has said things that you'd probably have to have, a degree in ancient languages in order to understand a word that he's saying, because he contradicts himself while he's breathing in. Yeah. And he refuses to answer questions. And yesterday we saw in the parliamentary committee in which he was being pushed upon on whether he's telling untruths, and he even lied about lying. What he did was he gave some completely irrelevant anecdote excuse me, under questioning, that had absolutely no relevance to the question. He was questioned about whether he sacked Matthew Hancock, and he started drivelling on about the £350 million on the side of a bus and how the statistics back him up. There isn't any statistics out there that come from valid data that back him up. But for him, that's become irrelevant. But that's another issue. So I think the problem is if you lie, at some point people just create their own truth from the words that come out of your mouth. And it doesn't have to be, a sentence. It doesn't have to be a paragraph. It's just taking random words and putting them together to formulate something that in your brain makes you feel better.
Yeah.
I think that's where UK PLC has got to. And it's not just obviously here, it's many other parts of the world as well, where you have right-wing politicians who've now manufactured a way to control large chunks of their population. If we can just continue, sorry, Tom, with this,
yeah,
this would place all at risk, including those already vaccinated within the UK and globally. While vaccines can be updated, this requires time and resources, leaving many exposed to the interim. Spread of potentially more transmissible escape variants will disproportionately affect the most disadvantaged in our country and other countries with poor access to vaccines. So here we have a particular demographic that the government pay lip service to when they have to, when they're put under pressure. But we can see by policy outcomes that the Conservatives have hardly ever given a stuff about those people who are vulnerable. And they only ever do it when they're really put under pressure, for example, like Marcus Rashford. Or they just leave it to charities or individual community groups to fill the void. Fourth, this strategy will have a significant impact on health services and exhausted healthcare staff. The same healthcare staff who have been asking for a significant pay rise and be told by the government that they can't have one, who have not yet recovered from previous infection waves. The link between cases and hospital admissions has not been broken, and rising case numbers will inevitably lead to increased hospital admissions, applying a further pressure at a time when millions of people are waiting for medical procedures and routine care. So you've got people who are now going to be much more vulnerable to COVID, whilst at the same time fighting off cancers and heart disease and diabetes and all these other types of illnesses. Yes, that they found, for example, over an 18-month period that they've had a lot less access to the healthcare service in order to treat these. Not no access, but there has been less access. But whose fault is that? That's the fault of years and years and years of underfunding of the National Health Service. That is the fault of, and I'm not don't care either way in terms of the vote, but that's the fault of the way in which the Tories have handled Brexit and alienated hundreds of thousands of European people who've worked in our National Health Service and other care services across the country. We are now seeing this morning the report out that there is a massive issue in terms of being able to get people in employment-based situations to come forward and work in this country, either domestically or from outside. We've got the CBI shouting from the rooftop saying that we need to relax immigration rules. All the while, the government continues to play its populist nonsense to a certain demographic in the country who are often, and not always, but often overtly racist and xenophobic. So we're appealing to a group of people who are hostile to those around them, hostile to humanity, who are very low levels of empathy. And we're calling that sort of a healthy democratic society. Not for me. Fifth, as deprived communities are more exposed to and more at risk from COVID, these policies will continue to disproportionately affect the most vulnerable and marginalised, deepening inequalities. So not only are we saying that the situation is bad, we're saying that the situation is going to get a whole lot worse. And just finishing off. In light of these grave risks and given the vaccination offers the prospect of quickly reaching the same goal of population immunity without incurring them, we consider any strategy that tolerates high levels of infection to be both unethical and illogical. So this is what we're talking about here now. The Lancet, one of the most esteemed medical journals on the planet, and it's extremely damning extremely damning of this government, and yet this government, by pushing its distorted, inaccurate message through the media, especially through the gutter press, the right-wing, sometimes far-right press, we are being given information that is simply wrong and, according to the Lancet and according to many others, will kill a lot of people in the long term. And also, in terms of their morbidity, they have long COVID, they will be ill, they'll be unable to work, they'll be suffering. So what this tells me, just finishing off, Tom, sorry, but what this tells me is the government doesn't give us stuff about healthcare. It only gives us stuff about its ideology.
Yeah, absolutely. And look, you mentioned an important thing there. We read that over 1 million people in this country now have long COVID, suffering with symptoms. Don't know whether, for many of those people, they don't know whether those symptoms will be persistent or, indefinite or permanent. For some of those people, it might affect their ability to ever work again. Really serious matter, and the implications for them and their families, for our health system, our healthcare system, our NHS in the future, for benefit welfare budget in future if large numbers of people are unable to work for the rest of their life. I mean, these are shocking, appalling consequences that the Tories are creating and stacking up for future generations for the next 20, 30, 50 years for our country, on top of, Brexit economic effects and other things. So, you're right. I mean, people say that, you should go into politics, become an MP if you wish to serve. I never get that feeling from Conservatives. I sometimes get that from other parties, if you like, that their intention is to serve and to try to enact bring into law and enact policies that benefit the vast majority of the population. I don't get that from the Conservatives. I get an ideology and policies that are based around enriching and benefiting the richest 1%, the richest and most powerful 1%. And all I get from their pandemic strategy and other things, like you say, their sort of populist nationalism designed to appeal to a certain demographic of voters, all I get from them is how do we lie and spin propaganda in a way that will get certain people to vote for us, enough people to vote for us so we can stay in power, so we can continue stealing all the money for ourselves and our rich mates and our donors.
And that, Tom, is who they serve. They do serve, they just don't serve us.
That's a good point. So who are they serving, Jace?
They're serving billionaires, they're serving lobbyists, they're serving people who can give them opportunities later on down the line. They're serving people who fund them now in terms of their party and individually. They're serving the shadows, if you like, the people in the darkness who are extremely wealthy, extremely powerful, and continue to be generation upon generation, who just put them in as puppets, having put them through public schools usually. They come from a certain kind of background. They're quite debased. They are low levels of empathy and understanding of other people's experiences. They're very sort of supremacist in the idea that they are born for the role, and that we should be subservient to their policies and to their soundbites. And of course, what we tend to find within individual society is more and more people start to question and challenge, and less people become subservient. So therefore, you have to create new control mechanisms, more control structures to try and keep them in line. And we're getting off topic now, we'll finish on this, but we saw that a lot between 2015 and 2019 with all the lies and garbage that was served up about Jeremy Corbyn and those people who supported him. So, I mean, back to the Lancet, Tom, just very quickly, back to the Lancet. It is a profound document that tells us that going forward, we should not be listening to this government. So for those people that do, and if they keep this government in power, they are imposing that upon those people who don't want it. So we become the real victims of conservative policy because of the people who simply don't care, don't do the investigation, don't do the research, also have a low level of empathy, etc., that are preserving their power base. So they are complicit. They